Allergies are a growing public health concern. Whether you have food allergies, skin allergies, or drug allergies, it's really hard to understand what exactly is making you have that certain reaction, whether it's swelling or stomach ache, headache, fatigue, anything. It's hard to know exactly what is causing that. One specific chemical compound is an antibacterial one, and it is in most house care or personal care products. It has negative effects, including skin irritation, endocrine disruption, antibiotic resistance, and even the contamination of water, which could destruct the aquatic ecosystems. It is so common that it's been found in people's blood, urine, and breast milk. And that is extremely concerning to a lot of mothers who will have newborns because it could harm them before they are even out in this world. It's been learned that triclosan blocks lipid synthesis by restraining the enzyme carrier protein reductase from type 2 bacterial fatty acid synthesis. Non-organic antibiotics and organic biocides are effective alternatives to this chemical compound. It's recommended that if you have a reaction to any products containing triclosan, that you just avoid it as best as possible. But we know that that's very tough for people to do, considering that it's in a lot of their healthcare products. But there are other ways that you can fix that. Bisphenol A, also known as BPA, is an industrial chemical in plastics and the linings of food cans. It's also in the production of polycarbonate plastics and epoxy resins. It can get into food from heat. If you heat up a plastic container with food inside, the lining of the plastic may seep into your food, which will then go into your body. One of the major problems of BPA is that it can cause insulin resistance. Insulin resistance in people is a forerunner of type 2 diabetes and a core part of one of the world's major modern epidemics, metabolic syndrome. Metabolic syndrome is a cluster of biochemical and physiological abnormalities associated with the development of type 2 diabetes. Insulin resistance in people is also tied to congestive heart failure. Symptoms of chemical allergies are
red skin.
Another symptom of chemical reactions is
scaly patches.
Another symptom of chemical allergies is burning or itching. Next symptom of chemical allergies is hives. One of the world's most popular allergies is pollen. Pollen is found in flowers, it can even be in the air, it can get to you from animals, being dragged into your house, different things. It's in trees, grasses. The types of pollen that most commonly cause allergic reactions are not the plants that have big, showy flowers, but the smaller ones, such as just plain grasses or even weeds. This type of pollen that does not come from big, showy flowers, the type that can cause an allergic reaction, is usually very thin and very powder-like because it's meant to travel by wind and not by humans or animals. The symptoms of pollen allergies include sneezing, wheezing, nasal congestion, itchy eyes, coughing, stomach pain, itchy throat, fatigue, irritability. There are many different allergy medications, such as Zyrtec or Claritin, that will help lessen all of your symptoms, whether it's just an itchy throat, whether it's all of them. And it also is extremely beneficial to change your sheets as often as possible, maybe once or twice a week even. Things that you bring in from outside, on your feet, on your clothes, hair, anything, going into your bed will stay there and continually affect you and create these symptoms, or even make them worse. The last and most fatal symptom of chemical allergic reactions is anaphylaxis, also known as anaphylactic shock. That is a potentially fatal allergic reaction, and during anaphylaxis, a change happens within the walls of capillaries, the smallest blood vessels in your body. There's a large drop in blood pressure due to leakage of fluid from the blood into different body tissues. The treatment for anaphylactic shock is much different than the symptoms that I have described earlier. The sudden burst of epinephrine, when administered through a pre-filled syringe into your thigh, sometimes can cause epi-shakes. Epi-shakes are not a seizure and will subside after a few minutes or even seconds. 20% of anaphylaxis incidents are followed by these epi-shakes. Once you've experienced any symptom or anything that you find concerning, thinking that you may have an allergic reaction to something, it's important to get tested so that you can receive the proper medication or different treatments. When you go to the doctor to get tested for an allergic reaction, they will either do skin prick test, intradermal testing, blood tests, patch tests, and challenge testing. Usually the skin prick test is first. The skin prick test is when a drop of solution containing the allergen is placed onto your forearm or your back. Using a small needle of some sort, the allergist gently pricks or scratches the skin to allow a small amount of that solution into your skin. Positive results are indicated by a small wheal, which is a raised white bump surrounded by a small circle of itchy red skin. Along with doctor visits, there are also commercial allergy testing kits for you to do at home. Those are not recommended, however, because they are not as accurate and they are much lesser quality. Allergies are a worldwide battle for most of the population. There is no proven effective way of primary prevention of allergic disease. However, there are so many steps that you can take and different precautions to be able to avoid the symptoms that you have. There are many different medications and things to help you with your allergies, but above all, it's important for you to find your own way to be able to deal with every allergy symptom that occurs. Allergies must be dealt with for our population to stay happy and healthy.
So, Meredith, what are you allergic to?
I'm allergic to Clearasil facial cleanser.
What happens when you use it on your skin?
My face always gets super red and itchy and it stings and it starts to peel, like in the places I put it.
So, what do you think is causing the reaction on your skin?
I think that the salicylic acid is causing the reaction.
Very, very good answer. Let's take a look at that. What are you allergic to?
I'm allergic to peanuts or anything that's been processed in a factory with peanuts.
So what happens when you eat peanuts or any of those other products?
My lips and my tongue and my throat get really tingly, and I sometimes get hives.
Are the hives hard to deal with, or are they, like, very functionable?
I mean, it's kind of, like, hard, but I don't really need an EpiPen because they're not that bad.
That's good.